The Healthcare Federation of Nigeria marks its 10th anniversary and the 2025 annual conference in Lagos, reimagining what access to quality healthcare looks like today and the future, leveraging innovation, partnerships and sustainability. Hello there and welcome to this Focus On as we spotlight Nigeria's ambitions of becoming a manufacturing hub for medical essentials and the preferred destination for medical tourism. I'm David Alabi. The president of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi, takes the stage, reflecting on the need to drive pertinent discourse between government, private sector and practitioners across the healthcare value chain, as well as trends redefining the sector.
Nigeria healthcare is improving. There's a lot happening in healthcare. You may not be aware of it, but there's a lot of people starting to come back into Nigeria from abroad to use some of our centers of excellence. We have several centers of excellence that have been created in fields like cardiology, orthopedics, fertility care, and people are coming in from around West Africa, as well as our Nigerians from the diaspora. And Nigerians from London, from the US, they're coming to have their procedures done here. And that can only be done if there's an element of trust in the quality and the standards that we provide. So there are lots of things happening in terms of promoting quality, in terms of accreditation. We're looking at some of our locations having JCI accreditation, some of our locations having ISO accreditation. There's safe care. There's a lot happening in that space. So it's an exciting time for Nigeria, and it's something that we need to pick up on, consolidate, and push forward into the future.
A starting point for engagement is the concept of trust, regulation, and ensuring that healthcare ecosystem is fit for purpose.
Putting regulation in place codifies quality as a deliverable for healthcare. And once you're able to do that, it's easy for patients to know what they're buying. Now, how are we doing as a committee? We're putting together all the systems, the standards, operational guidelines, and in terms of what we need to do, we need to pass a bill to establish the agency. So all of that is what we're working on, and we have 6 months to deliver this to them.
For a long time, very few people had health insurance coverage. And then, so in the past year, lots of progress has been made. About 16 million people were covered as of December 2023. And a year later, by December 2024, it was 19.4 million people. So we added over 3 million people in 1 year. That underscores, one, the need to even do more and to meet the unmet need for financial protection. The second thing we looked at was equity, which means that healthcare shouldn't only be for the rich. So how could we make sure that the poor are also carried along? So by implementing the Basic Healthcare Provision Fund, where the government earmarks a percentage of consolidated revenue for the poor, the NHIA has expanded that coverage.
Is Nigeria prepared for medical tourism? Well, stakeholders from primary to tertiary healthcare highlight the service delivery models and how these fit into the global imperatives for medical tourism.
This leverages on a number of different points. One of them is technology. We offer telemedicine, teleconsultations to people who live not just in Nigeria but outside of Nigeria, so that we can speak to them about their disease burden, their conditions, and look at how best we might be able to serve them. In addition to that, Uracare is actually quite uniquely placed because we have a lot of diaspora-trained physicians who have trained in some of the best hospitals and institutes all over the world, and they're bringing that expertise, that patient-centered care into Uracare and helping that to deliver that to our patients. We're already seeing an influx of people from all over the world, from the US, from the UK, from Canada, who for one reason or another, such as excessive waiting lists, expensive private care in those countries, and are looking for alternatives where traditionally they would have looked at places like India, for example. They're now looking wider afield to places like Nigeria.
Brick Clinic is Nigeria's foremost IVF-focused clinic, and we have been in existence for over 25 years. All right. Our offering, we have offerings for both men, women, and also couples. Our major service is IVF for patients who have difficulty at conception. But outside of IVF, we provide other services, including surrogacy, including PGT, that is screening out of genetic disease, and also family balancing. And also for couples or individuals who just want to know their fertility status, they can also come into Break Clinic. We also provide those services. And then for people in the diaspora, we've had people in the diaspora come back home to access our healthcare from Europe, from America, and other parts of the world. And there are two reasons for that. One is it's more affordable to come back home to do that. And also, secondly, for couples who want to do surrogacy or egg or sperm donation, they will be looking for donors who are Nigerians. Rather, it will be difficult for them to get abroad, so they would rather come back home to do that.
Good. So in order for us to be able to provide this care and provide a lot of support within the market, one of the major things that we've done is actually invest in the infrastructure and the equipment required to do this. Apart from investing in the infrastructure and the equipment required, we've also, as you know, we're a brand that is across the world. So we're based in another two countries, in Kenya and in Pakistan. What we're doing also is doing skill transfers across the countries. We have doctors moving across countries, coming to provide training, support, and education for the people that we're with. We're also able to move our expertise across and get them to actually learn new skills in the different hospitals that we work with. So we focus mostly on providing the right equipment, the right resources, and also focusing on quality, as is the theme now. So how do we do that? We're currently going forward, we call the Joint Commission International Accreditation. This is focusing on patient safety. It is the clinical outcome that actually determines how best a hospital is performing.
A commissioners' roundtable further unpacks the conversation from a subnational's perspective, with key themes around remuneration and plans to domesticate insurance.
If we're moving people to insurance-paid tariffs as opposed to out-of-pocket, then these discrepancies between what doctors are receiving as remuneration in Lagos and Nigeria is going to be narrowed, whereby we're now investing in the investability of healthcare delivery in Lagos and Nigeria.
What makes a worker stay? That is fulfillment at work, what I call joy at work. Knowing that your skills are valued, and knowing that there's prospect for you to progress. So by ensuring that we have the conducive environment, as you said, the infrastructure, and having the equipment, the right equipment, but having the right equipment alone is not good enough. We need the right experience. So, right mentors.
A chat with local manufacturers of medical essentials highlighted the need to implement recent healthcare executive orders while spotlighting the increase in scale of offerings across the production, distribution and supply chains in Nigeria and the wider African market. The Say Local Farmer is investor worthy.
Well, allow me to extend an invitation to you to our Shagamu campus. So that's a 60-hectare site that currently has 6 plants on it. 3 at the final stages of completion, one of which is an API plant, API standing for active pharmaceutical ingredients. So all the raw materials that are used in Nigeria across the over 100 manufacturers are 100% imported. During COVID, we felt the chill because we couldn't access. Countries closed their borders. We don't know what will trigger the next set of closures, yes. But for us, it triggered a commitment to bringing manufacturing of those products to the country. The first set of products are anti-malarials. We're very focused on what is ailing us on the continent, as well as what EMSO has competence in. We have over 20 different products for malaria that are currently on the market. So we also wanted to be one of the first off-takers of the products to also help de-risk. But then we also have an IV plant that's undergoing construction, and then 2 specialty antibiotic plants. A lot was said during the exit of some of the multinationals, especially around the poor availability and extreme inflation of critical medicine. So our expansion plans are targeted, as they always have been, towards closing gaps. Maternal mortality is a major contributor to the indices. I mean, we're always ranking within the bottom 10, so this is a commitment we have to bring that up. So a lot of research going on around children's medicines, but always with a focus on elevating the quality.
So at the moment we've got quite a couple of things under our portfolio. So at the moment we have about 150 registered. Obviously the amount we would actually manufacture at the time is heavily dependent on demand. So while we've got the potential to do a couple of things and have done quite a few over time, we would only focus on what really is viable. So at the moment, I mean, in terms of performance, obviously in the Nigerian market especially, I think what would say our top performer is a product called Vasoprine, a low-dose aspirin, that prevents blood clots, etc. But yeah, so because we've sort of got two separate factories that focus on two different things. So our factory in Enugu focuses on our oral production, so where we produce any tablets, capsules, liquid syrups, dry powders, Then in our factory in Oka is where we do anything sort of parenteral, so anything that doesn't go through the mouth. So eye drops, ear drops, injections, infusions. So on that side, I guess one of the more interesting products that we're doing right now, which is interesting one. So because we were the first to do it in Africa, at the moment I think we still are the only ones, is our oxytocin. So obviously because of the nature of the product, it's a cold chain product. So obviously the manufacturing conditions are a bit more complicated than the other ones, and obviously the distribution as well. So the distribution channels are a lot more controlled. So yeah, it obviously just makes it a bit more interesting in that way. And so for it, so far, I mean, it's been doing okay. In the Nigerian market, to be honest, could probably do a bit better than we would have hoped. But I think one of the things that's especially encouraging for us is what's happening outside the borders. So we're getting a lot of requests from, all parts of Africa. So from Southern Africa, West Africa, East Africa. And so we're just trying to almost like position ourselves to be able to take care of that demand while we can now.
I'd like to thank the government and especially Mr. President and the NAFDAC agency. What we wish is to execute the executive orders that they have put in place, Mr. President has put in place. The first executive order is the banning of syringes, and the second one is the waiver of duty on importation of raw materials. So this will help us boost our production and also our market share.
The incoming president of the Healthcare Federation of Nigeria shares insight into the focus of a leadership team with targets set on steering stronger private sector engagement with government, adoption of digital solutions and institutionalizing quality of healthcare.
For my tenure, is really how do I strengthen some of those engagements and actually bring private sector together, not just those within the country, but Nigerians in the diaspora who also have extra capacity and may be able to support what we're doing in Nigeria. So going forward, for me, is private sector, public-private integration at the primary healthcare level, which is key, primary healthcare. Normally you find PPPs at the tertiary. Two is how do we increase the adoption and utilization of digital technology in healthcare? Talk about telemedicine. Three is how do we institutionalize quality of care?
The conversations climax with a commitment to drive impactful change in Nigeria's healthcare system. That's it on this episode of Focus On, as we spotlight the Healthcare Federation of Nigeria's 10th anniversary and 2025 annual conference. Many thanks for watching. I'm David Alabi.